The most important Parvaropa, the premonitory symptom, is Kandu, which means itching around the joints. Now, the big concept in Vatarakta symptoms is the two types, Utana and Gambira. Morning stiffness, which we call stamba, is present in both types, but it's worse in Gambira. That's also a classic clinical symptom of RA. The stiffness reduces as the patient moves around, which is a Vata character. Let's map Vatarakta directly to rheumatoid arthritis. First up, location. Ayurveda says Hastapada initial involvement. Modern science, RA hits the MCP and PIP joints of the hands and feet first. Next is the hallmark of RA, bilateral symmetrical involvement. If the clinical case mentions Stamba, that is your classic RA morning stiffness lasting more than 1 hour, and Sandishofa, that correlates directly to synovitis, those warm, boggy, and tender joints you feel on examination. Now let's look at the severe Gambhira stage. When Ayurveda mentions Asti bone damage, think of modern panus formation leading to bone erosion. Mamsakshaya is the disused muscle atrophy around those joints. Highest yield things, Valgata means joint deformity, think ulnar deviation or swan neck deformities. Finally, Pakshavada as a neurological complication links perfectly to atlantoaxial subluxation or vasculitis. Charaka's treatment principle for Vatarakta is Snehana first, then Viratana. You treat with oleation and then purgation. Simple, powerful, and tested. Rakta Mokshana, most important karma for Vatarakta. Among all methods, Jalokavacharana, leech therapy, is the preferred one. Virakana Pagation removes vitiated pitta rakta, given after Snehana, Basti, medicated enema. Best for Vata predominant cases. Avagaha, immersion of hands and feet in medicated oil or decoction. And here's a must know contraindication: avoid Ruksha Swida, dry fermentation. It aggravates both Vata and Rakta. Use only Snigdha, unctuous, Swida. Guduchi, drug of choice for Vatarakta. Kaishori Gugulu, most prescribed compound formulation. Iranda Taila, castor oil, used in Viretana and Basti. Manjishta plus Sariva, Rakta Shodhaka herbs for blood purification. Amavata versus Vatarakta. Both involve joints, both involve Vata. So what's the difference? It starts with the core pathology. Vatarakta is Vata mixed with vitiated Rakta, while Amavata is Vata mixed with toxic Ama. In Vatarakta, the pain increases with rest and feels better when they move. But in Amavata, the pain increases with movement. If the patient says moving makes it worse, click Amavata instantly. Next, look at where it starts. Vatarakta hits the hands and feet first, Hastapada, and there are no signs of Amavata, it attacks multiple joints simultaneously and the patient will show clear Ama signs.